Do you know that according to the American Psychological Association, stress is linked to the sixth leading cause of death in the United States? Well, my name is Clarice G. I'll be talking about some of the effects of stress on our health. The image on this handout is an extract from an article written by Anne Petrangelo titled The Effects of Stress on Our Body. It's going to give you more knowledge about the effects of stress, while I'm just going to summarize some of the main points. According to the National Institute of Mental Health, stress is any change in the environment that require our body to react and adjust in response. Our body reacts to these changes with physical, mental, and emotional responses. Stress can play a part in problems such as high blood pressure, heart problems, premature death, as well as affecting the male and female reproductive system. We are going to start by looking at how stress affects the heart. According to Morgan Griffin, researchers have long suspected stress out type A personalities to have a higher risk of high blood pressure and heart problems. Stress can directly increase heart rate and blood flow and cause the release of cholesterol in the bloodstream. High level of this substance in the body can increase the risk of developing a heart disease. Now we are going to look at how premature death is linked to stress. A study looked at the death effects of stress by studying elderly caregivers looking after their spouse. It found out that caregivers had a 63% higher rate of death than people their age who were not caregivers. Now, let's move to the male reproductive system. According to the National Psychological Association, stress affects the male and female reproductive system in several ways. Stress causes the body to release the hormone called cortisol, which is produced by the adrenal glands. Cortisol is important to regulate blood pressure and the normal functioning of several body systems, but excess amount of cortisol affects the normal biochemical functioning of the male reproductive system. Going to sexual desires, chronic stress and ongoing stress over an extended period of time can affect testosterone production, resulting in a decline of sex drive and libido, and can even cause erectile dysfunction or even impotence. Going to reproduction, stress can also negatively impact sperm production and maturation, causing difficulties to couples who are trying to conceive. Researchers have found that men who experience two or more stressful life events have a lower percentage of sperm motility compared to men who have not gone through any life stressful event. Now let's turn from male to female reproductive system. Stress may affect menstruation among adolescent ladies and women in several ways. For example, high level of stress may be associated with absent or irregular menstrual cycle, more painful periods, or even affect the length of the cycle. Stress may reduce sexual desires, especially when women are simultaneously caring for young children or other ill family members, coping with chronic medical conditions, experiencing relationship difficulties or abuse, and also dealing with work problems. Going to pregnancy, stress can negatively impact a woman's ability to conceive, the health of her pregnancy, and her postpartum adjustment. Maternity stress can negatively impact fetal and ongoing childhood development. Now let's summarize. According to the National Institute of Stress, 33% of America feel that they live in extremely stressful condition. Well, our body is equipped to handle stress in small doses. But when this stress become long-term or chronic, it can have effect on your body. So if stress is part of your everyday life, you should be concerned about your health and your well-being. According to Alex Hamilton, it can feel like you are living a perpetual cycle of chaos, and over a course of time, the effect can be devastating to the body and to the mind. That is why it is important to find a coping mechanism that are useful and productive, as well as eating well, getting enough sleep, and also finding time to exercise. Thank you.